Jonathan will pick it up. Jonathan will pick it up, I'm sure, and then, you know, I'll sort of pop in some questions maybe afterwards, if that's okay.
Okay. Marta, could you put up the slides for Jonathan, please?
Give me one sec. I'll start talking whilst Marta, you're doing the honours with the technology. So, hi everyone. So, for those of you who haven't come across me before, I'm Jonathan Oates. I'm an acting director of public health for Islington, and I've got a lousy sore throat today, so do bear with me. I've got plenty of water next to me, but I may croak even more than usual. So I'm going to give quite a brief overview about what's going on in terms of COVID sort of related sort of infections and sort of hospitalisation, deaths, etc. At the moment. Give you a sort of just a brief overview about how the vaccination efforts are going, and then I'm going to talk about the government's living with COVID policy, which came out, I think, almost a week ago, and which obviously has leading to quite a few changes in terms of certainly the central nationally determined requirements around the response to COVID, and there will be further changes down the line. I'll tell you what we know about those at the moment, and within that context I'll also talk about the concerns particularly for our clinically most vulnerable members of the community and what some of the changes mean for them. So this first slide is just looking at the last 6 months in terms of confirmed COVID infections. Now, these are infections which were confirmed by PCR, so they're highly likely, certainly since roughly the start of January, to be symptomatic, because one of the changes that we had just after the new year was that if you had a positive lateral flow test, you did not need to get a confirmatory PCR test. So remember, lateral flow tests are a good but not perfect way of ascertaining whether or not people have infection, particularly people who may be highly infectious to others, and PCRs are viewed as the gold standard. So in other words, they are a much more sensitive, accurate diagnostic than the lateral flow test. But when you've got very high levels of infection in the community like we have at the moment, and we still have at the moment, then actually the added benefit of having a PCR test is actually pretty marginal. Or the vast majority of people who have a positive lateral flow test will have a positive PCR test. It's estimated that out of every 1,000 people in sort of the middle of January, when the change happened, who had a positive lateral flow test, only about 3 of them on a PCR test would come up negative who had true infection. But the other risk with PCR infections, there is always with any further test you have, you've also got a bit of a risk about having a false negative. So actually it makes a lot of sense to stick with it. However, in terms of this data, positive lateral flow test results don't go into the data. So you see the big drop between sort of early on in January in that dark blue line, which is a 7-day cumulative average of infections, and that's not related to a change in infection incident. It's just because of that change in testing policy. So what you'll see in this data allowing for that change is that we obviously hit that peak around just before Christmas and New Year, and then since then we've been seeing a reduction in infections, and what we're now seeing is a general drift down. So roughly from when that change happened through to towards the end of February, you see that blue line drifting downwards. Still, in the most recent week, still about 1,100 confirmed infections in the borough. So by any other period of time, that's an extremely high number of infections. And national statistics surveys would suggest that you can multiply that figure by 3 for the true number of people in the borough who are likely to have an infection. So it's probably more like 3 to 3,500 people at that current time. And the most recent national data suggests that probably at least about 2 million people in England in the most recent surveyed week did have COVID. So it is really still very prevalent. However, the most negative impacts or immediate negative impacts of COVID are all very much lower than we would expect given the levels of infection, and certainly compared to the first major national wave and that second big wave that we had basically this time last year. The impacts both on our residents and on the NHS is significantly less. So looking at hospitalisations as a measure of people with the most serious illness related to COVID, at the start of the year, we had about 660 beds occupied across the whole of North Central London. So that's not just Islington, that's also Barnet, Enfield, Haringey and Camden and all of the hospitals in North Central London. Now, those 660 beds now, in the most recent data we have, which was from yesterday, now stand at about 276 beds. So we've seen more than a halving of the number of beds occupied by people with COVID. And when we look at those people who are in primarily because they have COVID, as opposed to they're in hospital and they happen to have COVID. So obviously people going to a hospital are tested for COVID as part of infection control process. We see that just 36% of those 276 beds were actually people who were primarily in because they were ill with COVID. So in other words, that means that we've got roughly about 100 beds occupied across the whole of North Central London with people with COVID infection as the primary reason. And what we're also seeing is very few people are really at the most serious illness amongst the group. So people on mechanical ventilation, we're now looking at about 20 people on any given day, and the mortality rate is very significantly lower even amongst people who are admitted to hospital. So in terms of our local population, we are seeing no change in the underlying death rate from COVID. So anyone who's testing COVID since the autumn or winter. So even given that huge increase that we saw in December, January, we're continuing to see now, we are averaging somewhere between no deaths to around 2 deaths each week in the borough. And overall mortality is actually lower than we would usually expect for a winter period. So a lot of infections, but due to a mix of vaccines, population change, prior immunity because of previous infection, also antivirals and monoclonal treatments, which are improving outcomes for individuals, including those in hospital, we are cumulatively seeing a much less impact on the NHS and much less impact on the population compared to previous waves. Can we go to the next slide, please? And this is vaccination data over the last 6 months. This is booster vaccination, so it's not first or second doses. So essentially we can see huge increase in vaccination, booster vaccinations from roughly early December, carrying on all the way through into January, but then really falling back, not just locally but nationally. So overall, in terms of booster coverage, actually Islington is doing relatively well in London terms. So I think about 64% of people who are eligible have had boosters. Now, obviously, to be eligible, you need to have had your first and second doses. So there's an awful lot of people who are eligible for boosters who have not had those boosters, tend to be younger, just as there's the same skew in terms of who's had first and second doses. But what we're also seeing at the current time, and this has really been a feature really continue on for the autumn winter, but again really picked up through December, January and into February, is we're still seeing several hundred people coming in each week for first and second doses. And as I always say, we are absolutely delighted when we see them, and it's really beneficial. So for you as an individual getting a first or second vaccination, if you haven't yet had a vaccination, it does significantly reduce the risk of becoming ill, of being admitted to hospital, even though it doesn't necessarily protect you against catching the infection. It also, and we're quite clear about this now, it does reduce the level of infectivity towards others as well. So by getting those vaccinations, you are helping to reduce the risk to others, and that's really important. Cumulatively, I think we're now at about 410, 415,000 COVID vaccinations, first, second booster doses given across the borough. If we can move to the next slide. Thank you. And you may be glad to know this is the final slide. Certainly I am, given my throat. So living with COVID. So this is the government's, I suppose the best way to describe it is policy for sort of moving from having special measures in place around COVID to becoming much more like how we manage other infectious diseases, and in particular respiratory diseases. So in that context, and to be clear, I'm not necessarily advocating position here, but I'm explaining the rationale behind the policy. That previous two presentations for Islington, if you extend it out nationally, we're seeing the same trends. So essentially, an awful lot of immunity in the population because of vaccination. Boosters particularly important, and that huge increase in boosters between in December and January, hugely protective, particularly of our most vulnerable communities who have had a very high uptake of boosters. To an extent, previous immunity. So what we are finding with COVID is that even though it's mutated now significantly 4 times since it first emerged from Wuhan, is that previous infection does give you some protection against the worst impacts of COVID. And that seems to be the case with all of the different variants, including Omicron. The thing with Omicron is it is so very infectious, it can still infect people even after you've had your vaccination, even after a booster, even after you've had previous infection. It's the nature of how this goes, and that's probably how, as a respiratory infection, it's going to continue. We do not know how long that immunity will last for, but it's clear it's been very protective through the autumn and winter. The other aspect is that this version of COVID, Omicron, is less likely to result in serious illness and hospitalization compared to the previous version, but it can still be extremely nasty and can still result in hospitalization, particularly in people who are vulnerable and in people where they are not vaccinated or have very, only sort of very residual levels of immunity. So it is still a nasty infection for some people, but as with all other forms of COVID, one of the things to note is an awful lot of people get it are not symptomatic, don't know they've got the infection at all, but are infectious to others, and also a proportion of people will have just mild or passing infection. Now it's all relative. What could feel like a really nasty cold you might not describe as mild, but if it's not resulting in hospitalization or other issues, then it is certainly mild to moderate and not at the most severe end of the spectrum. What we don't know, obviously, with Omicron, although we do know with the other variants, is how many people go and develop long COVID. Now, the good news about the vaccinations is it is pretty clear that they are protective against long COVID, probably reduce the risk of long COVID by about half, and that's over and above the reduction in risk you get having in terms of getting the infection. And the other thing which is coming through, although I think it is a fairly clear signal, but with something as complex as long COVID is complicated, is that those people who are vaccinated actually have the symptoms of long COVID for less time. So vaccination, less likely to get the infection, less likely to get long COVID. If you do get long COVID, you are less likely, you will have it for less time on average than others. So all of that is really good news in terms of the benefits of vaccination. I think really important, particularly for some of our younger populations who may not view death or hospitalisation as a potential impact, but I think are probably much more aware of the impacts of long COVID. So that's sort of the context we're in. The other aspect of the context of this is about, as well as vaccinations, is about the range of antivirals that we now have, which can be given very early on in symptomatic infection to people who are most vulnerable to getting very ill and needing to go to hospital, and which are very effective indeed. And then on top of that, you've got monoclonal and other treatments in hospital, which are equally, for people who do come in and who are symptomatic, also significantly reduce the risk. So this makes this again more like other health conditions or other infections that we deal with, where we've got, if you like, effective interventions that can actually, health service interventions that can make a difference in how impactful the infections are. So if you take all of that together, that is the underlying rationale about the lifting of legal requirements associated with COVID. So in particular about the legal requirement to social isolation for people with confirmed infection, and changing requirements for contacts. So previously unvaccinated contacts did need to, for example, self-isolate, and all of that has gone. Linked alongside that is national contact tracing. The entire system quite literally ended within 5 days of that policy announcement. So completely stopped. All of the test and trace has just gone in terms of any proactive contact tracing. Now, this is replaced, however, by guidance and advice. And that guidance and advice is not actually different from the legal requirements. But what essentially it means is that individuals, if you like, the onus is on individuals to determine how they're going to respond to either developing symptoms, and at the moment you can still test, and whether or not you get infections, and how you manage that. The complicating factor of being issues such as, alongside the social isolation requirements going, is the additional payments around COVID self-isolation support for people on very low incomes and benefits has been removed. And employers will have different approaches to sickness absence, particularly since COVID is now being normalised as a reason for sickness absence along, you know, as part of these changes. So those are important caveats, but it is basically replacing the legal requirements with guidance and advice, which amount to similar stuff, but it is not mandated. It is guidance and advice, but consistent with how we treat other respiratory infections. So those changes have already happened. The next round of changes which are going to be happening are around testing. So whether it's symptomatic testing or non-symptomatic testing. Now, obviously, I'm very mindful that for many people, non-symptomatic testing in particular is a big part of their strategy, and symptomatic testing when people become ill is also part of the strategy to protect others and for reassurance for themselves around their health and well-being. Now, free access for most groups ends on the 31st of March. So I would be fairly clear that we will see symptomatic testing sites closing at the end of March, and that community collect arrangements will at the very least look very different than they do now. They will not be open to the general population. Now, the information which has come out, which is still not fully sorted, is that free access for testing for groups to get free access at the moment looks to be for people aged 80 and over, and who fall into the most clinically vulnerable groupings. So that is essentially people who are immunosuppressed or immunocompromised. And that's either because of treatments that they're on. In fact, actually, commonly it's because of treatments that they are on. Sometimes that's due to health conditions they have. The other group, which are at higher risk, are people with Down syndrome. And they've been, it's not about immunity in that group. There's other cardiovascular issues going on in that group, but they are the other major group identified as being at high levels of risk. However, government has said that they are looking still at who the vulnerable groups will be who will have access to free testing, but we do not yet know who those will be. And indeed, we're not we do not yet know how people will access it either. What we also know is that testing in specific vulnerable settings will continue, but they are very limited settings, and our best understanding is it will be testing of staff working in those locations. It will not be about residents, patients, or others in those settings. And the 4 settings specifically identified in the policy are healthcare settings, although we're not sure whether or not this is primarily hospitals or all healthcare settings. The NHS has written out last week saying that they again will be in contact with their services to inform them of what the arrangements will be. Residential care, by which we mean primarily care homes, special educational needs schools, and prisons. But we don't know, as I say, what those arrangements will be. We think it's most likely to be about direct delivery to locations, possibly in the health service, direct delivery to staff, but we do not know at the current time. The testing is likely to be lateral flow testing, but again, we don't have clarification around that currently. And then the other important element around this is about at-home PCR tests for people who are clinically vulnerable. Now, when we're talking clinically vulnerable now, I need to draw a distinction between people who were previously shielding. And remember, the advice about shielding actually ended for adults and had already ended for children and young people before in September. And the original advice and guidance around shielding was really in the context of 3 different elements. Firstly, we had very limited data about COVID and how it would affect people with a wide variety of conditions that could make them more vulnerable to any serious respiratory illness, but particularly COVID. Secondly, we didn't have vaccinations, so there was no way to give vaccination to people to protect them against infection. And finally, we didn't have effective treatments or the new antivirals, which have really become available since November, December of last year. In all of that context, when we're discussing clinically vulnerable in terms of COVID now, we're probably nationally talking around 1 to 1.3 million adults and children aged 12 and over who would still have a higher level of risk associated with COVID. Now, as mitigation factors, as well as booster vaccinations being offered, everyone in those groupings should have been sent PCR test kits that they could do at home if they become symptomatic, return to the NHS, who will very rapidly analyse the PCRs, and then should there be a positive result, within the next day, they will either be able to send someone to collect or be sent directly at home antiviral treatment that they can take at home, which will dramatically reduce their risk of infection. Now, many of these people also have been vaccinated, which similarly from first principles massively reduces that risk. So this becomes a really important element about helping our most vulnerable to stay well, but also as a means to giving them something to fall back on whilst the rest of society is pretty much, in many regards, is reverting back to pre-COVID behaviours. The other announcements.
Sorry, can I just ask a question on the antiviral and monoclonals drugs?
Could I take questions at the end, Renata?
Okay, that's fine.
Sorry, I did spot your hand, so apologies. So vaccinations are also being offered alongside this. So on a precautionary basis, spring boosters are being offered to everyone aged 75 and over, and everyone aged 12 and over who is in clinically vulnerable group as a precautionary basis. Now, this is because there are signs of a small reduction in the effectiveness of boosters. So boosters which have been given over sort of September through to now in terms of protecting against serious illness is a very small reduction in risk, but there's an awful lot of people who are potentially vulnerable. So spring boosters should be rolling out sometime from April in the community. The second aspect of that is that 5 to 11-year-olds are being offered the opportunity for vaccination as well. It is not being heavily promoted to them. It's described as a non-urgent rollout of COVID vaccinations, But the benefits for 5 to 11-year-olds, many of whom by now have had Omicron, best estimates are probably about 85% of primary school age children have now had COVID infection, of which Omicron has been very dominant, is that all of the evidence around the vaccinations are that they will be protective against the risk of future variants in the way that previous infection with Omicron is unlikely to be given experience. So there is a future benefit, because the other backdrop to all of this is that COVID is at high levels. We will see other variants, and for at least the next 12 to 18 months, we remain in a position where we will continue to see changes going on in terms of the infection. I've mentioned the drugs already, but there are antivirals which have now been approved for use and which are available for use in the community. And we've had monoclonal treatment, which is basically a way to boost your immune response to a serious infection in hospitals for some time. All of the other advice about guidance about other safety measures to reduce transmission risk for self and for others still hold. Ventilation, washing your hands, wearing a face covering indoors, in public places, etc. All of those aspects remain relevant and are still highly protective. The two future elements which are important, and which one of which is resolved and one isn't, is firstly about ongoing surveillance. So if we have a lot less testing going on in the community, how will we know if we get another major variant? So the national surveillance studies are going to continue. So that's the work which is coordinated by National Statistics, working with academic partners. There will be testing in vulnerable settings, and that there will be genomic sequencing of those tests as well. And there will be international collaboration around testing around infections which will identify whether or not internationally new variants emerge. So that aspect will be squared off. It will probably be slightly slower in terms of identifying new variants, but it will nonetheless, compared to lots of testing in the community, but nonetheless it will be there. And then the other bit, particularly for people like me, but if we do get a serious new variant, then potentially for the community, is that the ongoing future health protection and surge responses. So in other words, what happens if we get big outbreaks of COVID, if there is a major new variant coming through? All of those details are yet to be confirmed in the guidance. The guidance basically says we will find out more closer to Easter. So my guess is we'll hit the 31st of March, and either a few days in advance or on the 31st of March, when the testing is withdrawn to most people, we will get some guidance about what that will look like. There's clearly a very large national conversation going on. The only thing which is clear in the policy is that government will set a very high bar in terms of what the risk is before thinking about introducing further restrictions in response. So I think that brings me to the end of the slide set, and I will finish there. And apologies, Renata, for not taking your question during the slides.
No, it's perfectly fine. Sorry, I came late, so I wasn't sure. I just wanted to know if the drugs, the antiviral drugs that you have spoken about, and I know the monoclonal are given in hospital, but are they prescribed as a routine by GPs to people that currently have COVID?
No, they aren't, and it's being run through our hospitals. So essentially, there are large drug stocks being held by our hospitals, which are ready to be either directly given to people who attend on behalf of someone with a confirmed infection, because obviously if you've got the confirmed infection, you should be self-isolating at home, yeah. Or will courier the drugs to you at home. So you don't need to be registered with a GP. You don't need to go for your GP to get access to the drugs. If for any reason there is a problem with getting access or with registering your positive result, then you can ring the 119 number, which will continue to be, if you like, the COVID response telephone line. Or if there's a problem, you are advised to go for your GP. Locally, I think we'll be looking at other ways we can promote, firstly, awareness about this, but also other ways where we might need to help people to get that access. Because the thing is, it's important to get that access very quickly. So basically, if you start getting symptoms, test. you get the drugs within the day of your result. So test, send in, you should get the result the following day. The drug should be available on that day or the following day, and you need to start taking the drugs within 5 days of the onset of symptoms to be most effective.
But I mean, that's interesting. And because you giving this message today, I have had people that including myself, have had COVID, and those drugs I know they've been available since December, January. But nobody gave us this advice. There's no advice on any of the communication I had. I even had a phone call from Test and Trace, and nobody has said, actually, you know what you can do? You can get those antiviral drugs from your...
So the antivirals are intended for the 1.3 million clinically vulnerable groups.
Okay.
Now, and the underlying issue about that is that they are very expensive.
Okay, but
they are
a couple of members of my team who are still off are in that 1.3 million vulnerable group, and they haven't had that advice. So I'll go back to them and speak to them. But I mean, It's 5 days have gone by now, so it's not good for them. But at least the fact that they don't know that, they were saying that there isn't anything that we can take. That's what they were told.
Okay, so this illustrates why we're putting a greater emphasis on it locally.
I think it's really great. Thank you for that.
Yeah, the NHS should have written out in December, and failing that by early January, to all the 1.3 million people in those clinically vulnerable groups. And what that would have been sent them a PCR test that they can do at home if they're symptomatic, and give them advice about how to access.
Thank you, Jonathan. Sue, did you want to come in?
I just want to sort of come in because I'm very much aware that people want to talk about advice and we need to sort of move on to that. But just very, very briefly to say where we sort of feel like we need to go as a council and as a community, really. I suppose the first thing is that we need to recognise that there's an awful lot of good news in there, and that it really does change the way things are for most people in the borough in terms of how it is that we can live our lives and so on. And it would be even better news if we could get more people vaccinated. And so, we're continuing to put a big emphasis on getting all those people who haven't had their first, their second or their booster vaccinations in to get them. And Navinda is sort of very much involved in an effort that's very much working within community and voluntary organisations and so on. Once we're a bit clearer about everything, and you can hear from Jonathan that there's quite a lot of gaps in there, I think we're also very keen to see that everybody gets to know as much as possible about the options they have for testing, for treatment and things like that. And we may look, for example, to supplement what's available nationally, potentially with, people being able to phone We're Islington, the phone line, and just ask about those again if they're not clear about what's possible and so on. But we need to work with health service colleagues on that, obviously, because you've got to get it right. And we're now into really giving people advice that often have quite specific conditions, and we're not, we are not as a council going to be giving that sort of advice. It's more about where you go and what to do, and when it's important to do things quickly and so on. We're also, obviously, once we've got something in from government, going to pull together the Outbreak Control Board that some of you are on. That is essentially about what you do if there's an outbreak, and to work with all of our partners to make sure that we've got an updated plan, so that if there is an outbreak that we need to be concerned about, we will all be working together to a plan and sorting that out. I think the other two things, and these are things I'd like you to sort of take away and think about and come back to me on. I'll put my email in the chat in a moment. One is that we've got two groups of people in the borough who I'm quite worried about. That some of them are in both groups, but there's people who are clinically vulnerable, and I'm very much aware that the definition of that has changed a lot. And I'm really talking about people who are clinically extremely vulnerable, as opposed to just vulnerable. I think we're at the stage where people who were vulnerable, can pretty well get on with things. But then there are some people who have conditions and are extremely, extremely vulnerable. And the concern is that with the loss of all of the various defences, if you like, against infection, that leaves some of them, and I'm sure you've read articles in the press, letters, things like that, posts and so on, from people saying, what am I going to do? Am I meant to just stay indoors and never go out? Because I can't now use services, etc., because there's no longer going to be a mask mandate. I'm no longer assured that things are going to be distanced and things like that. And of course, a larger group probably are people who maybe don't have any clinical reason for that in the sense of formal, you know, sort of disease diagnosis or something like that, or disability, but are very anxious. And they spent 2 years, you know, not leaving the house. And certainly I've been door knocking a lot recently. And we do meet a lot of people saying, no, we haven't been out for 2 years. You know, we get our kids to bring us everything. We get deliveries and that's it. And we need to find ways in which those people can be brought back into our communities and living their lives. Because I think, you know, we lose a lot by not having them. You know, a lot of them have been the lifeblood of many of our communities and voluntary organisations and so on. And they lose a lot and potentially get more anxious and more ill as a result. So I'm thinking we need to find some way of being able to, first of all, consider those people when we're organising activities, because sometimes you can just make them a bit safer by making sure that buildings are properly ventilated, that organising activities with an outside component as well as an inside component as the weather gets better, that sort of thing. And whether we can look to just sort of badge those and tell people very clearly when we're doing anything, you know, can we say this, you know, this event will have, you know, you'll be able to come to this event by sitting outside, or even considering having sections or something where you're requiring people to wear masks and so on. So I think we need to think about that, because we're all very relieved that we can finally fill up our community centres and do all the things we've been desperate to do for the last 2 years, and have all our postponed AGMs and all that sort of thing. But we need to think about the people we're missing out, just as we would with anybody in terms of disability. It's about making reasonable adjustments to people. And although some of those people may be simply anxious, I think by thinking about everybody else's needs, you can also tempt them in, if you like. So it's really thinking, can we do a lot more about having those sorts of events which are relatively safe for people, and badging them as being relatively safe so we can get them along. I think the last thing I would say is we lost 415, I should have checked the figures, I think, people. We lost 415 Islington residents to COVID over 2 years. That's absolutely devastating. I mean, it's devastating for those of us who lost people close to us, but it's devastating for all of us as a community. You know, it's not just our mothers, you know, our aunts, our cousins or whatever, our stepdaughters in my case. It's also, you know, the shoemaker, the cheesemonger, the people who drove our buses, the people who worked in our care homes. So I think we do need to say something about the value of those lives that we have lost, and do that as a community together. So we've got a small meeting about that, which one or two of you may have been invited to, I'm not sure, to think about. There is a day of reflection being called for the 23rd of March, and think about having an activity around that. But again, I'd be really keen to hear from all of you about ways in which we might be able to remember the people we've lost and celebrate their lives and mourn the losses that we've had, because I think it would be a terrible thing for us to just sort of shrug our shoulders and walk away from that. So as I said, I'll put my email in the chat and welcome thoughts and so on from people.
Thank you, Sue. We're going to move on to the advice conversation, but James and Zena, do you want to just make some final questions or comments?
It was just a quick question for me in terms of Jonathan. Yep. Jonathan, you mentioned a period of 12 to 18 months, and I just wanted to be clear, because again, when we're talking to young people in our context about what did you mean by that, is if you could just give a little bit of detail about that, that would be great.
Thanks, James. So, I mean, I think we can be completely clear that COVID is now endemic. So in other words, it's simply circulating in the general community. It's not going to go away. The general consensus of opinion, which may be wrong, but is not unreasonable, is that it's still likely to be over the next 12 to 18 months, simply given the way in which this infection has changed patterns of immunity within the community, and also the community reactivating, is that we're likely to have 12 to 18 months when we will have COVID basically very prevalent throughout the year, and probably subject to further changes, which may well be serious changes. The 12 to 18 months is sort of grounded also in progress on vaccination. So globally, there is still an awful lot of vaccinations that need to be given around the world in order to really reduce the amount of infections sort of rolling around. The more infections you've got, the more chance you've got of mutations, etc. So that's where the 12 to 18 months comes from. It's not going to disappear after 12 to 18 months, but we suspect that it will it will sort of regularize into whatever pattern it's going to have into the future.
And will there be particular peaks and troughs to do sort of seasonally?
Quite possibly, but we don't know.
Okay, thank you.
I'm just going to take the last question from Zena, and then Maria, if we can put the question in the chat, and then we'll follow up later. Zena?
That's fine.
Yeah. Okay, thank you. I share the same sentiments what Councillor Sue was saying, in the sense of building up the confidence of our service users, and that's due to knowing that we are keeping up the social distancing and we are testing staff members. But if it becomes, I think, April the 1st, not free to get the test kit, that could be a problem for us as a charity and working around vulnerable people. So how would that work for us as a charity? Because paying for rapid tests is going to be a problem financially.
You're right, Zena. In fact, it will be a problem financially for just about every organisation if government are reducing it. So, I mean, one of the things we're working on, it was really more to do with the sort of events that Sue was talking about, was post 31st of March, what are the things available to us generally to help to reduce risk without having the testing available, etc. And that's something that we can obviously develop and share around, but there will simply, the government decision is that generalised free testing, as would be the case with other respiratory infections, which can be very serious in vulnerable, which the flu is the obvious one to consider, is we don't have a policy where we just test to prevent against it. So that's the context we're in, Zena. But I think there's something about how we navigate that change so we can be as safe as possible whilst we actually don't have testing. And as I said right at the get-go around the testing aspect, I absolutely recognise that it is a strategy that many of us use personally and organisationally.
Okay, thank you.
Thank you, everybody. Ellie's put in the chat what VCS partners are doing collectively with in collaboration with public health, and we will send out what we're doing. But essentially, I've talked about it at other previous meetings around our campaign to still have conversations with local people about vaccination hesitancy, but most importantly, having the conversation to support our local population on their vaccination journey. So we've put it in the chat. Lots of things are going to be happening, and we will send more information about that. So we really wanted to get two big items in today, and we wanted to talk about advice in the borough. And we've got some VCS colleagues from some of our larger advice organisations, and we thought we'd kick off. Gerard, are you going to, is it Gerard or Gerard? I'm sorry, I never get that quite right.
Yeah, I mean, I'm happy to kick off, although I will admit I didn't realise I'd do the first one. But yeah, anyway, I'm Gerard O'Master Milton from Islington People's Rights. We're a well-established independent advice agency, basically providing specialist welfare benefits and advice. We tend to use the term specialist, but in reality, we provide welfare benefits and debt
Jared, we
advice.
can't hear you very well. It's kind
Oh,
of,
right.
yeah, it's breaking up a little bit.
Yeah, sorry, I'll try and go closer. I'm not sure my laptop.
That's much better.
Sorry about the big but it sounds better. We're part of Islington Advice Alliance, which is basically Islington People's Rights, Islington Law Centre, and Citizens Advice Islington. And it also involves help on your doorstep. Well, I suppose help on your doorstep are here, but I mean, help on your doorstep in some ways is slightly different in that they tend to refer clients to us rather than being an advice agency. I can very briefly say what we do specifically in other referral routes, because I think people may know but may not. I mean, I suppose whilst we talk about specialist welfare benefits and advice, it's also about the clients that we tend to serve. So, I mean, our core clients are local residents with disabilities, mental health issues, addiction issues, whereas we work with certain BAMA groups and others. And that's always been our sort of bread and butter in terms of supporting some of the most vulnerable residents. Part of that, we have specific referral routes with a number of mental health services. And thank you very much to the Council for funding, I suppose, our core service as well as these. People's information, I mean, that's what's known as the North Rehabilitation and Recovery Centre, which was based at Lowther Road, but actually it's somewhere else now. South Rehabilitation Recovery Centre, although which is at South Street. Also iCope, which has a north and south service, in fact, and the Islington Crisis Resolution Team based up at Highgate Mental Health Centre. So those are all sort of well-established specific referral routes we have. We also currently have one with the Discharge Facilitation Team or Discharge Facilitation Service, which is based up at Mental Health Centre at St Pancras Hospital. Those are other specifically, related obviously to mental health clients. We also have a referral route with Better Lives, which is a drug and alcohol service, helping them. Those are all referral routes relating to welfare benefits and debt matters. We also work closely with a number of community centres, notably the St Luke's Community Centre, although that's been a bit in abeyance, let's say, because of but we're looking to establish our services. Yeah. And then we specifically have referral routes in from Help on Your Doorstep currently because of some funding. We're just establishing something with the Manor Gardens Centre. And our problem really is very high demand for our services, as you could imagine, and I think COVID has made it even more of a challenge. Having mentioned earlier Citizen Advice Islington and Islington Law Centre, and I'm glad that I'll hand over to them. I would want to go first. We do have a specific project where we're working with Islington Law Centre currently, it's called Islington Direct, but it gives us an ability to housing referrals and immigration referrals in their direction, and I think potentially they can make referrals in our direction, but actually they also deal with welfare benefits and debt. And we do have a relationship with Citizens Advice Islington. It's worth mentioning, I think, that with those two agencies, we also have, I think, arrangements on occasion to do with conflict of interest, because there can be issues on occasion if a couple separate and they're
Jared, it's really hard to hear you. So I'm thinking
yeah.
perhaps we bring, is it Stuart?
Yeah, so maybe I should hand over to Stuart. And
yes, and then
I
we'll
don't know.
bring in Jeanette and then Eileen.
Yeah,
and, yeah, because Eileen's going to talk about the iMax and Jeanette will talk about her service. Go for it, Stuart.
Well, hello everybody, I'm Stuart Hearn, I'm the Director of Islington Law Centre. Can everyone hear me?
Yes. Yeah.
I've got a really weird screen through Eventbrite. I can't see anybody really. So, but anyway, so the Law Centre is very much open. We're seeing clients both virtually and in the Law Centre itself. And we're working very closely with the other advice partners, particularly Help on Your Doorstep, with Gerard at IPR and Citizens Advice. We're working in the same way as before, as much as before. We're very keen to access our clients. One of the things we have found is that we've done a lot of remote working, and a lot of our clients actually like remote working and would rather see us remotely, certainly initially. What we're doing is trying to see people remotely as much as we can by telephone or Zoom or email. And then if we need to see them, we can offer face-to-face appointments in the law centre. So we're kind of doing a mixed service at the moment, but we're very much open and providing advice services. Is there any specific issues that people want to discuss about advice?
When we thought about this, we were thinking about what you're seeing on the ground, in terms of, demand. I'm sure obviously your demand has gone up, quite significantly.
Yeah, I can tell you about that. We obviously do advice across the board. So we've always been very busy with our benefits and debt, and that hasn't changed really. We're as busy as ever, seeing similar things. Housing has been one of the big issues because the courts for a while were suspended, and then they've been operating at a different service. What's happening at the court now is that possession proceedings are being issued. They've dropped their two-stage process. They were seeing people virtually at the court and doing 10 appointments a day or 10 hearings a day. They've now moved to about 20 hearings a day. There's quite a backup of court cases that haven't been listed. So I think lots of possession claims have been issued but are waiting for hearings. And what we're seeing is people with much higher levels of rent arrears. So that does make it more difficult to deal with. The courts themselves have been quite sympathetic to people with rent arrears if it's connected to COVID, but just the sheer amount of arrears is an issue. And what it sounds like is that the listing issues being resolved, I think it's because the court didn't have a lot of staff. So we were expecting to have more and more cases listing, and there is obviously quite a backlog of cases. So there are a lot of people with rent arrears, and with rent arrears at higher levels than they had before.
Stuart, do you mind telling the people on this call how people can refer into the law centre?
Yeah, well, people know us because with the law centre, people know about law centres. You can just contact us directly. We also work very closely with Help on Your Doorstep, so they refer clients into us. The council can book direct appointments for housing and possession cases directly with us. And we work with our partners as we have a kind of referral arrangement. So, I mean, the best way is you could just telephone the law centre and we'll arrange a service for you.
Thanks.
Thank you, Stuart. Jeanette, and then Eileen.
Hi everyone, I'm Jeanette from Citizens Advice Islington. For those that don't know about the services, we cover the whole borough. So we offer advice to everyone in the borough on any subject. So we would be the generalist filler between, say, Gerard, say the Law Centre and Islington People's Rights. Although we do have specialist services. So we cover all the social welfare services, welfare benefits, debt, housing, employment. We have specialist casework services in welfare benefits, debt, housing and employment. We have specific projects, specifically the Help to Claim service, which you probably all know about, that's DWP funded to help people make their universal credit claim. And we're there for those, particularly with complex needs, digitally excluded. The Help to Claim service is in its third year. So what's important for the borough is to know that the DWP recommissioned the service and Citizens Advice nationally, and we are digital, went to bid for the service, and Citizens Advice have the service for the fourth year. We're not part of that service. The model was unworkable. We felt it's digital only, it's a national service. This won't affect Islington residents in any way, as the free phone number will be exactly the same in the next year, but we won't be at the job centre, which is what we were at Barnesbury and Islington. So we really felt our effects when we were out there with the users there, and that was taken away. So there were different changes as well. So, but that service is still there. we have an employment specialist service called ILANS, and Islington is part of the RCJ advice, so I won't go into that too much, but any issues with court any person has, they can get help as a litigant in person, or family help, or legal advice. So our employment law, we have lots of issues with shift workers. I think there was a message in the chat about debt, so I could go into detail about the services. So just talking about what one of our big projects, Debt Free London. So we've noticed an increase in all of our services in terms of the actual number of unique inquiries, the complexity, the coupled with mental health, anxiety, and everything else is more intense. So one of our topics, for example, we have EU, the pre-settlement and settlement inquiries, and it went up 138%. So we get, there's certain areas that are really are rising. In terms of debt, we offer referrals direct from the council for under the prevent strategy for welfare benefits, debt and housing. And in terms of debt, the take up is really low. So we have 6 appointments each Tuesday, which will go to face-to-face. They're currently callbacks, although the advisor's in the office. So if you're a council employee and you want to refer, speak to Chris Albridge and the teams, because that's underutilised. Most clients won't engage with the debt process. So in Islington, coming up this Friday, we have a debt bus that is going to Brickwork. So thanks to Colin and the team to host the bus. So that will be there for any resident. There's 2 COVID-safe interview rooms to go in and talk to our 2 specialist advisors who will be there from 9 to 5, and the bus will be open 10 to 5. If people don't know what to do, they can drop in for confidential one-off advice. We can take the number, we can call them back, we can arrange something else, or we can see them there. We're set up, if people do any online banking, we can go straight into a debt confidential advice. We're going to be at St Luke's on the 15th of March, and we're going to be in Mildmay on the 14th of March. In terms of debt, one of the big issues, obviously the perfect storm of the fuel crisis, cost of living, rent arrears, council tax arrears, every arrears. We're looking at compiling a crib sheet, a fact sheet, and I'll pass it to Gerard and Stuart's team, and perhaps the Shine team and Age UK, just to see if they want to add anything. So we're looking at top tips for people dealing with debt, like, for example, don't have an estimate. Make sure, they come around once a year to measure your meter. Make sure, otherwise you'll be paying a higher tariff, a higher amount for 11 months. And there's information about smart meters, prepayment meters and everything else. So we're going to put some top tips. Money Saving Expert, really, we lead on quite a few of those, but that's really useful. And then on the flip side of the page, we're going to put information for community partners with links to websites, and obviously any resident also can follow that. So we're kind of doing simple tips, and then on the flip side, if anybody wants to know more or how to get appointments, we have loads of appointments for debt advice. So that's the only kind of area where we have capacity. We're part of Toynbee Hall, so we have 5 debt advisors in Islington, which is a great asset. We fought for that. We've got another 10 months. There's loads of politics going in about the debt contracts. So whilst we've got them, we utilise them. We have a housing solicitor. So when we got Grace, we asked permission of the Law Centre. It's a legal aid contract, which is ruthless, and the Law Centre, I think it was then Ruth, agreed, we could have Grace here, and there's loads and loads of work. So housing is massive. I don't know how much I could keep going on. We're funded by, it's really good to see Sarah here. So we got funded by the council, Cripplegate, and Cloudsley. We're a new partner with Cloudsley, and obviously Debt Free London. But we don't attract much funding because we're part of the RCJ. So I'm technically one of the smallest funded citizens advice because of the RCJ. But we do a lot. We score green for quality throughout. Access is our weakest point, and we're looking to join the Pan London advice line, and there's masses of big movements in London for citizens advice, and we're trying to lead on them with possibly Citizens Advice London, and there's loads of things that will come out in the news very soon that I'd love to tell you all, but I can't. So with the mayor, so there are things that we're trying to do to help particularly our black and minority ethnic communities affected disproportionately, and how we can do that around the whole of Islington, working with faith groups. So there are different things that we'll be able to announce. Anything else?
Great,
Yeah.
thank you, Jeanette. So once you get your crib sheet, could you send it to VAI and we could circulate it with all the other information as soon as you've got your announcement next week and anything? And we'll send the recording out as well, because people then can hear the the context and the background to the advice. So Eileen, you were going to talk about the iMax offer.
Hiya, yes, I'm Eileen. I manage the iMax team. So iMax is part of the council service. We've got 9 equivalent full-time workers in the team, and we specifically deal with welfare benefits. Our referral pathway is very straightforward. The only criteria that we ask for is that you're an Islington resident to access the team, or you're being supported by Islington. You're either an Islington care leaver elsewhere, you're a foster carer, or you've been placed outside of Islington in temporary accommodation under the Homeless Persons Act. So that's a very straightforward criteria, and we've got an advice line that's run daily between 9:30 and 4:30, and it's actually been staffed now by real members of the team. We did have it going to voicemail. That was the only thing we were able to do while working from home, but the team have been coming in all since the beginning of lockdowns and things like that, because we found it is the only way to actually see the more vulnerable members of Islington who needed kind of hands-on support, perhaps to access their universal credit journal or to make a claim for personal independence payment. What we're seeing at the moment, I think, is just a huge increase in the demand for the services, and it's because I feel that universal credit is very difficult to negotiate once you're on it, in terms of like managing it. Also, it's the benefit cap means it's not enough for a lot of people, particularly if you're renting privately. So people need to come to us for support, say with a discretionary housing payment. Our DHP budget has been announced in the last few days. It's been cut by 1/3 for every local authority up and down the country, which is a huge cut, and we're going to have to think about ways in which we can manage this cut for the people that we currently support, and for new people that are affected by welfare reforms and have changes in their circumstances. It's slightly worrying, I've got to say. I think what we're finding is that people cite the cost of living really has been the sort of major impediment really. And it's interesting, Jeanette, from what you're saying in terms of the debt advice not being taken up. I actually think people are frightened, because once they start doing that, they're going to be terrified as of what's going to be unravelled in terms of, perhaps rent arrears, council tax arrears and things like that. So there's a lot of fear involved around people's debt, and how to approach that. And I think going forward, the COVID support being withdrawn, there's been a lot of money, chucked at local authorities to support people who've been affected, and once that's all been removed, I'm really worried about how people are going to manage on their incomes, and their incomes are correct, according to the government, they're getting the right amount of money. So when they come, say, to the RSS, which is the other team that I manage, and they cite that cost of living is impacting on their ability to manage, they're in the same situation perhaps as most other people claiming universal credit. So it's very difficult, and that's my worry really. How are we going to manage that, the recovery part of it?
Thank you, Eileen. Maria, is that a hand up from the last question that you had, or is this a new hand? I think it might be an old hand. Okay. Sue?
It's from before, sorry.
Oh, no problem.
Apologies, so is mine. Yes, apologies.
Okay, so we have a lot of information that's coming into the to the chat. So Una, you're saying everything's gone up. Yeah, food, heating, bills, everything's gone up. Yeah. So we'll circulate a lot of the information that's gone into the chat in terms of the debt buses that are going to Brickworks and Mildmay, as well as the information that Gerard, you've put up about the IPR and other advice agencies here. We'll wait on the crib sheet and other information, and we're trying to improve how we collate and disseminate information through VAI's news channels. Is there any, where's Annette? As a small group, did you want to add anything? Do you want to raise anything from your side? You don't have to. I'm sorry, I put you on the spot, but you know, you do such fantastic work, and I just wanted to.
Thank you. Yeah, what we are facing is a lot of people are now lost to their jobs, and access to universal credit being difficult due to most of them are digitally excluded. So we are receiving many clients with urgent support need. So we are working, you know, extra hard to respond to community need, and if they don't get help, they go through a depressive state. And yeah, we've seen a lot of people who are suffering from depression related to so services have been difficult, and we can see that many vulnerable people also felt left out. So what we are doing right now, especially for those isolated housebound people, we created like WhatsApp group, so for them to chat, and also we are delivering women self-help group sessions every 2 weeks, and it is gone, you know, just it's very, very effective, and bringing more isolated women from different backgrounds coming and learning together, like sharing their experience, as well as learning sewing classes. And we have to, by now, from knitting classes, now we are delivering sewing classes. So I have, there are a lot of things we wanted to showcase during the COVID up to right now, what women developed the skills, and they are taking the service delivered by ex-service user who had sewing skills. So she is now delivering this. And also we have a group who provides befriending through WhatsApp, telephone contact, so that isolated people cannot feel left out. So yeah, so that is how we are managing. And the advice sessions services are very needed. And as everyone explained, they are extremely busy. Even when we refer clients to say, the waiting list is a lot through the law center, and yeah, and when we refer also clients to other groups, they come back to us due to language barriers, or yeah. So yeah, everyone in the borough is working really hard, and the demand is getting greater, and so yeah, thank you.
Where's Annette? Mabratu?
Thank you, Navinda. Can you hear me? Yeah, thank you. I just want to add what Ellen was mentioning about the HDP. I don't know, for those people who are not aware about the HDP, is the housing discretionary payment, where you are paid by universal credit, and then your benefit cannot cover, you know, your house rent, and then that's it covered for 3 months. By the benefit office, you know, you apply in 3 months' time. So I'm very worried, as she said. Now we need to communicate with residents, you know, because a lot of people will be affected. That one, it is very serious matter. Yeah. So I just want to highlight that point, because we know from a lot of people, you know, supported by that HDP, and then I don't know what will happen after April, and a lot of people will be eviction. Or they will go out of the borough somewhere else. So it's very, very difficult, and then we have to highlight that one. That's what I want to mention. Thank you.
Absolutely, thank you. That's absolutely the point. Both those things, people will be either evicted or will have to move out. Yeah, totally.
Absolutely.
Yeah, thank you.
Thank you. Yeah.
Victor?
Hi, it's the question, really, Navinda. So the outcome of this meeting or conversation, are you trying to pull together information relevant to those who need advice support? And in which case, I was just wondering, because we obviously don't have all the groups that provide advice that will be relevant. So exactly what are you trying to do following this session today? And if it's pulling together information about where people can receive advice, how do you then link to those who are not present today?
Yeah, I mean, making the information available as to what services are out there for sure is to, I think that's do we feel that information is getting out to our local people? Is it a matter of the demand? We've already discussed that demand is exceeding what we have in the borough, and what can we do about that? Is it more connectivity between the services? But it sounds like that's happening anyway. Yeah, it's all the information so that we can actually circulate it quite widely to groups, let people know what's actually available in the borough, and take up of the underused services, as Eileen was saying, and others. But if you feel that we need to have particular actions as a result of this, it is to actually have a conversation about what we feel is needed at this moment in time and going forward, in order to ensure that local people have the services that they need. Una, did you want to?
Yeah, can you hear me? Because I've had terrible computer trouble tonight. See, we phoned a lot of advice, and there is a lot of advice out there, but this is the problem: is do people always know? So happy if anyone thinks we should feed it in with octopus networks and our community centres, because we're used to doing newsletters to TRAs and community groups. We're more than happy to do that, and we're still running the We Are Islington line, still very busy with energy top-ups most weekends. So if anyone wants to feedback through you, Navinda, and let us know, I'm sure Alice and our team, and I can see Shabana and others are on this, we can link up. But sometimes the feedback I get is there's so much out there, it's what's needed now. So I think Councillor Lukes is right. We're at these things where we've got different groups of where people rightly so scared. There's people not in for 2 years. I love the idea that Westnet, and they've got this WhatsApp group and they're encouraging each other. And I think it's a bit more like that. If you know someone, you maybe been a food parcel, can you say when it's nice, come on, go for that little walk, do those things outside, and let's share those. So that by the time we get into the winter, and most of us are in anyway, winter, it's dark at sort of early, let's get that bit of life out there in the summer. And I'd really consider you, and there's a bit of opportunities coming up, because there'll be some bits of funding over the 4-day, and I always say you shouldn't need Jubilee celebrations to have outdoor street parties or close the street, but it may be something people want to use that opportunity. Let's get out a neighbour, do something together. So happy for anyone to contact the VCS team with that, and we will sort it out and pass it on. But you're right, I think people, and just to know that if citizens advise that if you do need an appointment face to face, this is what you do. It's just getting it all out there again, but there is a lot going on.
Thank you, Una. James, and then Ellie, and then I think we'll finish because we're just going over time. Yeah.
Sorry, Navinda, it was just a quick thing to say a quick question to see if there was any news on the conversation from last time around the 3 target areas of Bunhill, Finsbury Park, and I can't remember the third area, I'm sorry.
Holloway, do you mean in terms of vaccinations?
There was talk last time about targeting, I believe, specific groups within those 3 areas, and there was going to be some funding that was going to be available to promote that within those 3 areas. Is there any news on that?
There is, but we'll pick up with public health colleagues after this and in the near future, and let people know about that. Is that okay, Miriam, if I've said it like that? Yeah.
Thank you.
Sorry, I'd muted myself. Ellie.
Yeah, it was just in answer to Victor's question. I did invite all the advice partners in the Islington Strategic Advice Partnership, but not all of them could make it tonight. But because I'm taking the minutes, I'm very happy to email them and ask if they want to email in a bit about their service to me, and I can include that in the minutes, because they do go to like quite a wide range of organisations that are on the Community Conversations mailing list. So I can do that to make sure everyone's included.
Thank you, Ellie. And Miriam, do you want to just have the final say on the...
Oh, I just wanted, sorry, I'm dialing in from my phone and I can't see anything or use any of the buttons. Yes, the short answer is yes. That's the work that Navinda alluded to earlier. So our partnership work around promoting vaccine uptake, developing new communications approaches, looking at local pop-ups, and those three areas are squarely within our sites.
Thank you. Great discussion, great information, much to do following this. And yeah, so is there any other final comments before we leave for the evening? Thank you to everybody for joining. Very useful information and discussion, and we'll compile information that we can circulate widely. Okay, thank you.
Thank you, Navinda.
Thanks,
Navinda.
Thank you.